Okay, so I'm gonna step outside. Hi, good morning. My name's Carol. I'm the nurse practitioner today. Can you tell me your full name?
Ruby Villalobos.
Very good. I'm gonna perform hand hygiene as I'm talking to the patient and performing my general survey, just noticing dress, skin color, tone. Patient is well groomed, clean, appears in no apparent distress, no problems with respiration. Ruby, do you prefer me to call you Ruby or do you want me to call you by your Mrs. Dello?
Villalobos.
Villalobos?
I'm fine with Ruby.
Very
Ruby's
good.
perfect.
Can you tell me your birthday?
It's 2493.
And do you know where we are?
Yes, we're at the clinic
The
right
clinic?
now. Yes.
Very good. How did you get here today?
I drove myself.
You drove yourself?
Yes,
Awesome. So patient is alert and oriented ×4. She is engaged, active, and friendly. So if it's okay with you, I have on my chart that you're here for a physical exam today, just an
Yes.
annual checkup.
Yes, ma'am.
Is it okay if we begin?
Yes, ma'am.
All right. My hands are a little cold because I just used the hand sanitizer, okay?
Okay.
I'm sorry.
That's fine.
I'm going to start with your scalp.
Okay.
I actually have to put my hands on your head.
Okay.
And I'm noticing symmetry. Face is symmetric, eyes are symmetric. There's nothing seems to be off. There's no lumps, there's no bruising. Hair is clean. There's no lesions, no matting in her hair. Hair is thick and what's the word I'm thinking of? It's appropriate for age. After doing the head, I'm going to move on to facial symmetry. Eyes are symmetric, nose is midline, nostrils are even. Can you open your eyes great big for me? Can you close them real tight? Frown, smile real big and show me all your teeth. Very good. I am going to, that is cervical nerve 7 is intact. I'm going to touch you with the Q-tip. This is soft, this is sharp.
Okay.
Okay? Tell me if you can feel this, and if it's soft or sharp.
Sharp. Sharp. Sharp. Or soft. Soft, soft, soft.
Okay.
Soft. Yeah.
Okay.
I'm like, wait, yeah, soft.
Very good.
Soft.
So, cervical nerve 5 is intact. Since you wear glasses,
Yes,
I'm gonna check your vision.
Okay.
I'm gonna hold this about 14 inches away from you,
Okay.
and I want you to read the lowest line you can see. Cover your right eye.
LTFPH.
Very good. Cover your other eye.
Okay. LTFPH.
Very good. Cervical nerve 2 is intact. I am going to feel your sinuses, okay? Any tenderness?
No, ma'am.
Frontal and maxillary sinuses are negative for pain. I am going to look in your eye with an otoscope, so if you can take your glasses off, you set them to the side, or I can set them over here.
It's fine. Set them to the side.
The first thing I'm going to do is I'm just going to check your pupils for reflexes. I'm going to shine a really bright light in your eyes. Very good. Pupils are equal, they're round, they're reactive. The external parts of the tissue are clean. There's no drainage, there's no nits, there's no lice. Everything looks good. Can you just move your eyes up for me? Look down. Look to the side. Very good. I'm going to pull your skin down right here. Mucosa is pink and healthy. There's no drainage. Sclera is clear on both eyes. Both eyes are accommodating and work together. I'm going to have you follow my finger just with your eyes. Don't move your head, okay?
Okay.
Very good. All 6 cardinal gazes are intact. So cervical nerves 3, 4, and 6 are intact. There's no nystagmus. There's no shaking in the eyes. Eyes move fluidly together. Okay. Now I'm going to look a little deeper into your eye,
Okay.
so I can see the. Sorry, I'm going to put my hand right here. That way we don't bump into each other.
Okay.
Okay. Red reflex is present.
Yes, ma'am. Sorry. No, you're fine.
Optic nerve or disc is yellow orange in color. There is no hemorrhaging. Look straight into the light. Macula is present when looking straight into the light. Sorry, I know that
You're
takes a little
fine.
longer.
Yeah,
It's a little bright, I'm so
no, you're
sorry.
fine.
All right, we're gonna do the other eye. Red reflex is present. Optic disc is seen. Cup to disc ratio is 1:3. Look straight into the light. Macula is present when patient looks straight into the light. There's no hemorrhaging in the eye. That doesn't look to be any problems internal with the eye. You're doing a great job. Thank you so much.
Yes, of course, yes, ma'am.
All right, I am going to look at your nose.
Okay.
At this point in the exam, I would be checking for cervical nerve 1, which I would have you plug one nostril and smell something that's common like an alcohol swab, but we won't be doing that for this exam because we don't have those.
Okay.
This should not hurt. I'm gonna look at your nose externally. The nares are even, they're symmetrical, there's no drainage, there's no exudate, there's no erythematous tissue. Turbinates are visible, there's no swelling. Tissue is cherry red. Nose is cherry red, turbinates are clear, there's no drainage, everything looks good. I am gonna look in your ears,
Okay.
okay? Do you have any pain? I'm gonna check against your mastoid process. Any tenderness?
No, ma'am.
External ear canal is clear. The tragus and the pinna both appear to be non-erythematous. There's no swelling. I'm gonna look inside your ear. Temporal membrane is pearly gray in color. There's no drainage in the ear. There's no swelling. I'm gonna stand behind you.
Okay.
And I'm gonna whisper.
Okay.
I'm gonna whisper a number.
Okay.
Put your hand over this ear.
Yes, ma'am.
33. Very good. I'm gonna look at the other ear.
Okay.
The tragus and the pinna are both clean. There's no drainage. There's no erythematous tissue. There's no swelling. External ear canal is clear. Internal ear canal is clear. Temporal membrane is pearly gray in color. There's no swelling. There's no edema. All right, I'm going to stand behind you again. If you can cover your right ear.
Yes, ma'am. 33.
Very good. Cervical nerve 8 is intact. Oh, and do you have any pain on the mastoid process on this side?
No, ma'am.
All right, I am going to look at your mouth.
Okay.
Just have you open up real big for me and say, ah. Stick your tongue out. Move it to the left, to the right. Lift it up. Very good. Teeth are clean. They're clear. I don't see any chipped teeth. I don't see any broken. Go ahead and open again. The buccal mucosa is pink. There's no drainage. Uvula stays midline. Swallow for me. Very good. Cervical nerves 9 and 12 are intact. Cervical nerve 10 is intact. There's no drainage, there's no exudate in the oral mucosa. I'm going to just have you lift your head just a tiny bit and look a little bit to the left and go back to the center. The trachea is midline, there's no tugging, there's no pulsations. I'm going to listen to your carotid artery. What I'm going to have you do is take a deep breath and hold it, and I'm going to listen to both sides with my stethoscope, with my bell, and my diaphragm, okay? So take a deep breath and hold it. Very good. Exhale. Very good. The jugular vein has no bruise, or the carotid artery, there's no bruise, there's no tympani. I'm going to feel with my hands. There's no pulsation and no distension. I am going to stand behind you so I can examine your thyroid, okay? and tip your chin down. Thyroid and trachea are both midline. I'm going to stabilize the thyroid with my left hand and feel along the right margins. There's no nodules felt, there's no swelling, there's no goiter. And now I'm going to stabilize with my right and feel with the left. No nodules, no goiter, no swelling present. While I'm here, I'm going to go ahead and feel your occipital lymph nodes. If you feel any pain on any of the points where I touch, please let me know.
Yes, ma'am.
Post-auricular lymph nodes, retropharyngeal or tonsillar, preauricular, parotid, posterior cervical, anterior cervical, submandibular, submental, and subclavicular. There are no nodules felt. Patient does not complain of any pain or tenderness. Are you doing okay so far?
Yes, I am.
Okay.
Yes.
So after I finish with the head and neck on the patient, I'm going to, can you shrug your shoulders for me? Just lift them up and down. Cervical nerve 11 is intact, so all cervical nerves 1 through 12 are intact. I'm going to move on to just the general survey of the thorax and upper body on the frontal view. Everything appears to be symmetrical. Shoulders are even. Breasts are in line. Patient doesn't seem to have any issue with breathing. She's not struggling to breathe. I'm going to feel skin is warm and dry. It's pink. According to the color is normal for her ethnicity. I'm going to lay my hands on your chest and have you say 99 until I say stop.
Okay. 99, 99, 99, 99, 99, 99.
Very good. There's no tactile firmness felt. So I am going to listen to your lungs in all 8 lung fields. So I'm just going to have you take a deep breath in and blow out through your mouth.
Okay.
Very good. Lungs sound clear. There's no adventitious lung sounds heard. I'm going to listen to your heart, and I'm going to listen to each point with both the diaphragm and the bell, starting with the aortic. Diaphragm, bell, pulmonic, and then click.
No,
Here,
it's
I'm
fine.
sorry.
No, you're fine. Do it to me
Herbs
too.
point. Tricuspid. Diaphragm and bell. And mitral. Very good. I'm going to feel with my hand for the point of the highest point of pulsation, the PMI, and then I'm going to listen to that with my diaphragm and my bell. Very good. Heart sounds are S1 and S2 at each point. There's no extra sounds, there's no murmurs, there's no clicks. I'm going to go ahead and go around to the back and review the back, the posterior thorax. So shoulders are even, they line up, scapula is equal, everything seems to be symmetric. Patient's skin is warm, dry, pink. I don't see any lesions on exposed skin. There's no nevi that needs to be graded on the ABCD scale. I am going to listen to the lung sounds in all 8 quadrants. And I'm going to have you say 99 again
Okay.
until I tell you to stop, all right?
Yes, ma'am.
99?
99, 99, 99, 99, 99, 99, 99, 99.
Very good. There's no tactile primitus felt. I am going to auscultate the lung sounds. Just take a deep breath and blow out. Very good. I don't hear any adventitious lung sounds. Everything sounds clear. I am going to percuss over the lung fields. I don't hear any dullness, anything that resonates, anything that sounds like fluid. I'm going to put my hand on the costal, sternal, and the margin, the CVA. You're going to feel me press. Tell me if there's any pain.
Okay. No, ma'am.
So posterior spine or posterior thorax is negative for CVA tenderness. I am going to listen one more time and have the patient repeat E to test for egocaphy. Just say E.
E, 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 E.
Very good. There's no transfers of the E to an A sound, so everything sounds as it should. All right, I am going to come back to the front and we're going to look at your abdomen, okay?
Okay.
Do you want to put your glasses back on or you want to sit over here?
I can put them back on,
Okay.
that's fine.
I would normally have the patient reclined at a 35-degree angle. Turn. If you want to sit on your elbows, you can, or if you just want to, however is more comfortable for you.
I'm fine with either one, so.
So lift your chin up for me. I'm going to look at turn your chin just a little bit to the side. I'm going to look for the point of the biggest pulsation of her on her neck. I do not see any distension. I'm going to evaluate going from the top of the jugular vein towards the sternal margin and measure. And it is within 2 centimeters, so it is normal. I need to test your hearing on one more point in just a minute. Go ahead and lay flat for me. I am going to just look at your tummy, okay?
Okay.
There's no nevi, there's no swelling. The contour is flat. There's no pulsation noted. I'm going to listen for your aortic artery and your renal arteries. I am going to auscultate all 4 quadrants of the abdomen. Vowel sounds are present in all 4 quadrants. I'm going to do light palpation. I'm going to press on your tummy a little bit, at least twice in each area.
Mm-hmm.
I'm going to percuss the same way, okay?
Okay.
It does sound dull over the liver, as should be expected. I'm going to place my hand behind your back and try to feel the liver.
Okay.
Liver is about 1 centimeter below the costal margin, like it should be. There's no lumps, there's no swelling. I'm gonna attempt to feel the spleen. The spleen can sometimes be felt. I do not feel yours. I don't feel any organ enlargement. I'm gonna try to check the left kidney.
Mhm.
I cannot feel the left kidney, which is normal, okay? Everything feels okay. I'm gonna check on this side for the right kidney. I do not feel the edges of the kidney. I'm gonna do palpation. Any pain?
Mhm.
Went a little deeper with this one. I don't feel any organ enlargement. I don't feel any masses. I don't feel any pockets of fluid. I'm gonna press right here.
Okay.
Let me know if it hurts when I let go.
Okay. No.
So McBurney's test is negative. I'm gonna go ahead and have you sit up. You can sit up and you can turn to the side on the table again if you would like. Are you doing okay?
Yes.
All right. I am going to check your ears and then we're gonna do some sensation test, okay?
Okay.
So I'm going to start this. Tell me when it stops. Do you hear this? Do you hear it in the same when it's touching you and when it's in the front, or is it stronger in the front?
It's stronger in the front.
Good, so that's normal. We're gonna do this side. It's really hard to get
Yeah,
this.
you're
Sorry.
fine. Mhm. You need to tell me when it stops.
Mm-hmm.
It stops
Okay, and is it stronger when it's touching you or when it's in the front?
in the front.
So that is normal. This next test, that's a Ryan test. This next test is called a Weber test, and it's just gonna go on the top of your head,
Okay.
and I need to know if you hear the same in both ears.
Okay. Yes.
Is it equal on both sides?
Equal on both sides.
All right. So I'm gonna test sensation on your arms.
Okay.
Just tell me if you can feel that.
Yes. Mm-hmm. Yes.
The sensation is present. I'm gonna have you, we're gonna check the range of motion in your arms. So lift your arms straight up, out, to the side, bend. Try to touch your hands to your scapula, up, and then put your arms like this, out, over, rotate your wrist, bring your elbows in, very good. So abduction, up, down, all the range of motion is present, +5. I'm gonna check strength, if you can do your arms like this one more time. Okay, don't let me pull down, very good. Don't let me push back. Put your arms out, I'm gonna do your wrist. Don't let me bend them, okay. Good job. So strength is +5. I'm gonna check your reflexes in your arms, so I'm just gonna have you like, let your arm relax. Sometimes it's easier if you don't watch me, like you watch up at the ceiling, okay?
Okay.
So I'm gonna check the brachial reflex first. Very good. Tricep. Really good reflexes, right? And the brachioradialis, go about 2 inches in. Very good. Reflex is +2 on the right. Now I'm going to test the left. Okay. Tricep. Very good. Reflexes are +2 on both extremities. I'm going to have you hold your hands like this
Mm-hmm.
and kind of look up at the ceiling, and I'm going to check your popliteal or your patellar reflex. And I'm going to check your Achilles. There's no swelling, no edema. Skin is warm and dry. I am going to check your pulses in your ankles while I'm here. Let me check the top of your foot. All right, I'm gonna check the strength in your feet. Push down like you're pushing a gas pedal. Okay, don't let me lift them up. Very good. Rotate your ankles in circles. Very good. Lift your knees. Very good. Can you pull your knees to the side? Pull them in. So full range of motion in hips, knees, and ankles. I'm going to check your brachial pulses. Radial. All pulses are +2 equal. There's no bounding. Make sure my computer is still running. The next thing we need to do is I need to make sure neurologically everything is sound. I'm going to have you stand up for me.
Okay.
Can you put your feet together? Hands to your side. Okay, and close your eyes. There's no swaying, so Romberg test is negative. I'm going to have you walk towards the wall over there and back, just a normal gait. Just walk how you normally would and turn around and come back. Okay, and one more time, but walk heel to toe. Can you do heel to toe?
In front.
Yeah, and they don't have to touch, just one foot in front of the other.
Yes, ma'am.
Okay. Turn around and come back. Very good. Go ahead and have a seat again. So gait is normal, there's no swaying. Can you hold your hands like this? Can you turn them over? So hand movement, arm movement is equal on both sides. So the movement is accommodating and equal. I'm going to have you lay down. I forgot to do one test and then we'll be done. And it's a special muscle test that just makes sure you don't have any sciatica. So just relax. You can relax your leg. I'm just going to lift your leg. Tell me if you have any pain in the back of your leg or your hip.
I do not.
Okay. So the straight leg test is negative. You can go ahead and sit up. I'll have you sit up if you want. Do you have any questions or is there anything else I can do for you?
Not at this time.
Thank you so much. At that point, the exam is over. Patient tolerated it well.
Okay, thank you.
Thank you.